and I take the opportunity to welcome the participants both from Guinea, Togo, Madagascar, and Niger to this very informal and useful information session on lab information sessions. We really welcome this collaboration being supported by EXA, and I will be walking you through some overview slides that gives you a snapshot on how Project Stella started and how it has evolved in order to ensure we achieve sustainability. So high-level summary for Project Stella. This was an initiative that was initially started in 2021 following an assessment that was conducted by the Africa Union CDC at the height of the COVID pandemic, and was primarily focused on the African countries that were lagging behind in COVID-19 testing in terms of meeting the WHO testing targets. Based on the assessment outcomes, a Global Fund did identify 23 countries, which were basically high C19RM investment countries, which were lagging behind in COVID-19 testing targets. However, as of 2022, the COVID situation significantly improved, and Project Stella redeployed its resources to focus on laboratory system strengthening core capabilities, as well as establishing capacity for lab-based surveillance using wastewater-based surveillance initiative. Additionally, in November of 2023, the Global Fund Investments Committee did give us an approval to expand the Project Stella initiative to a cohort 9 new countries in order to expand as well as scale up wastewater surveillance and lab system strengthening initiative. Implementation in the 9 additional cohort countries will be commencing in July. Further to that, based on the core need to strengthen lab systems, our in-house leadership additionally approved for a further extension of Project Stella, and this was coming on the 16th of April 2024. And we did get an approval to implement a sustainable knowledge transfer initiative through a multi-country peer learning model that is geared at institutionalizing proven best practices as well as innovative solutions for integrated lab system strengthening. The proposed activities for the peer learning initiative, which brings us to this webinar today, builds off on Project Stella investment areas and core interventions, and focuses on innovative solutions that have been identified as challenges to implementation at the individual country level. With that, now Stella moves to our TA provision modalities from external technical assistance providers to African countries with strong capabilities within the designated lab areas to focus more on acceleration of implementation of integrated lab system strengthening in countries with low lab systems maturity levels. Next slide, please. So to give you a snapshot of some of the high-level overarching Project Stella results and successes, which have been focusing on a few core interventions on laboratory policies and governance. You can see the results there. I do not want to go into all the many details. There has been significant efforts also to support strengthening of data management systems and interoperability solutions, with notable results achieved in over 70% of the target facilities. There have been support for broad lab system strengthening with a focus on sample referral systems, biosafety and biosecurity, quality management systems, as well as waste management systems, with significant achievement in over 139% in terms of building those core capabilities. On integrated lab quality testing, again, this anchors on the global fund RSSH indicators, which again are very core to integrated testing with key modalities around integrated testing, modalities, as well as training and updating of testing guidelines at the individual country levels within the scope. Surveillance has been a hallmark of Project Stella with implementation in 6 countries to support wastewater surveillance initiative, and that has seen a successful implementation in all the 6 countries: Kenya, Uganda, Tanzania, Mozambique, and Zambia. Next slide, please. It is worth noting that significant investments have gone into integrated lab system strengthening, with the background in the past that Global Fund had been very strong on investing on laboratory supplies, that is reagents and consumables, lab construction related activities, as well as renovation and equipment procurement. However, since 2021, there has been a shift towards investing more in integrated lab system strengthening activities, which has seen a significant investment of 563 million since 2021, divided into GC7, taking up 124 million, GC6, 108 million, while COVID-19 resource mechanism grants takes the significant share of 58% of the investments at 331 million. This demonstrates that Global Fund puts high priority on supportive services to enable efficiency as well as effectiveness of diagnostic systems. If you look at the graph on the right, you can see where most of the money has gone with the 3 key interventions, that is specimen referral and transport systems, lab information systems, as well as laboratory governance structures, generating consistent demand throughout GC6, C19, as well as GC7 investment envelopes. We can also see that through COVID-19 response mechanism, laboratory-based surveillance has generated significant demand, and this has culminated into subsequent investments to develop laboratory surveillance capacities, both within the C19 RM grants ending in December 2025, as well as follow on through the GC7 grants. It is worth noting that significant investment is also going into supporting quality management systems, as well as laboratory supply chain systems to ensure capabilities around supportive structures to ensure round-the-clock availability of supplies that are essential to support testing. All these structures cannot be supported without sufficient capacity, and structures are based on a diagnostic network optimization and geospatial analysis, which is a core priority for Global Fund, and these are also being funded through GC7 as well as C19 RM investments. Additional highlights would also be available in annex slides, which will be available once shared with you. Next slide, please. A clear match to sustainability of Project Stella, stemming from the initial investments on integrated lab systems. We now shift gears to a peer learning and collaboration model that will enhance uptake of proven best practices and innovative solutions for integrated lab system strengthening. A core objective of this initiative is to institutionalize strengthening towards sustainable laboratory systems, as well as build capacity within our diagnostic networks, while leveraging on established regional capacities to promote peer learning, to enhance, to enhance fund absorption, as well as acceleration of implementation for impact, while limiting over-reliance on international TA. This is very critical to catalyze implementation of laboratory investments, both in C19RM as well as Grant Cycle 7 grants. Principally, the selection of countries was based on Tier 1 and Tier 2 cohort countries, or extended to non-Tier 1, Tier 2 countries with significant investments in relevant lab interventions, that is on the 5 core areas under the peer-to-peer learning model, as well as countries which have significant funding on integrated lab systems in both C19 as well as GC7, and also focusing on countries with relevant performance framework indicators that are reportable in GC7 as well as C19RM grants. This initiative is being coordinated by the Eastern, Central, Southern African Health Community, that is ECSA, which is an international regional organization with over 40 years of experience in managing multi-country grants, and is also a principal recipient for Global Fund grants since 2015, and has a lot of experience implementing multi-country modality grants within the African regions. It is worth noting that ECSA will be tasked with facilitation and coordination of the multi-country coordinating peer learning model, and will be tasked with the responsibility of facilitating both mentor and mentee countries in terms of facilitating your travels, accommodations, as well as any activities related to hosting, as well as need for traveling and per diem related expenses. Next slide, please. A key highlight on some of the priority intervention under this initiative. Implementation will have a timeline of June 2024 to December 2025. And some of the interventions related to adaptive leadership training had actually commenced in June, while the peer learning model implementation will commence from July of 2024 to December 2024. The selection of the mentor countries, you'll excuse us for these terms for now, based on the use of the connotations mentor and mentee countries. The mentor countries are the peer countries which have shown exemplary successes in terms of implementing the 5 interventions around lab information systems, integrated sample referral systems, wastewater surveillance, equipment maintenance, as well as EQA and PT production. Based on these interventions and best practices, we did find it worthwhile for them to share experiences and best practices with some of the countries which are also in need of support and collaboration in order to bring their practices at par and in direction to where we would really want them to be in terms of implementing these core interventions. In terms of implementation modalities, this will include country field visits, hands-on training, as well as technology transfer through virtual mentorships and on-site mentorship. And also, it is expected that ECSA will support you to establish communities of practice so that you'd be able to have hands-on modalities to share practices in this platform through the mentor and mentee countries within scope. WhatsApp groups will also be formed so that you'll be able to share experiences as well as lessons learned in a real-time manner. On the right, you'll see a table there which identifies the priority interventions, but I would want to focus today's meeting on integrated lab system strengthening, integrated lab information systems, as well as interoperability solutions, which will be supported by Rwanda as the mentor countries given their exemplary performance in this area. The countries classified as mentee countries which will be supported under this model includes Guinea, Togo, Ghana, which will be the cohort 1 countries to go through the peer mentorship exchanges, while cohort 2 will include Benin, Niger, Chad, and Madagascar, which will be the cohort 2 countries. And the Rwanda team who are with us in the meeting will be able to share with us the timeline when these cohort country exchanges will actually commence. Further to that is to confirm that these exchanges and this core priority intervention are aligned to the Global Fund RSSH indicator, PP Lab 4, as well as M&E 5.1, which align to countries' capabilities on electronic data exchanges, as well as sharing of patient-level results. Next slide, please. What are the implementation arrangements as well as measures of success? As I've mentioned, EXA will facilitate and coordinate implementation of the peer-to-peer learning initiative by supporting your travel, both within for the mentee as well as mentor countries. They will also make arrangements for hotel accommodations and any meeting venues pertaining to the peer learning as well as per diem related expenses. Further to that, the mentor countries, in this case Rwanda, will provide supportive training environment to the 7 countries in scope, with the 2 possible rounds of training of not more than 4 countries. It will be expected that the peer learning will extend invitation to a maximum of 3 participants per mentee countries, and that is based on the nominee list that was shared with us by the respective MOH. And each training round will consist of a maximum of 12 participants per training session, and that is geared at ensuring that we realize maximum value during the peer exchange visits. It is expected that implementation of the peer learning exchanges will end in Q1 of 2021, allowing room for implementation up to December of 2025. If possible, again, the mentor country, that is Rwanda, will also be able to make visits to a few sample mentee countries in order to ensure they provide follow-up support visits in selected mentee countries. And it is expected that the follow-up exchange visits will end in Q4 of 2025. Again, in terms of measures of success, and this is very key to Global Fund and will inform some of the follow-up modalities and monitoring of outcomes that we will be closely monitoring together with EXA in each of the mentee countries. Part of the measures of success includes improved laboratory systems core capabilities reflected in SPA as well as JEE scores. And this includes a positive reflection on RSSH indicators. You can make reference to slides in the annex. We also expect that the peer mentorship model will enhance engagement between the principal recipients as well as laboratory directors at country level, and this will ensure ownership and enhanced implementation of the soft integrated lab systems related activities by the laboratory directorates with enhanced fund absorption and ensuring impactful service delivery. We also expect strengthened laboratory collaboration as well as fostering of relationships within the laboratory networks at country level amongst laboratory leaders within the African region, as well as at the individual country level. It is expected that there will be pre as well as post-training assessments to ensure the initiative meets the theory of change, that is at startup as well as at closeout of this initiative in December 2025. Next slide, please. We'd also wish to share with you some of the experiences from the peer exchanges. On the slide there, you can see some of the experiences by the Ghana team who visited Uganda to share experiences on the specimen referral and lab information systems. But in this case, we'd wish to take you to the next slide. Marcella, if you could move to the slide on LIS. I would just wish to put focus on the expected exchange outcomes on LIS for this session. And our colleagues from Rwanda would be taking us through the peer-to-peer learning modalities, exchanges, expected outcomes, and some of the expected implementation arrangements that they'll be sharing with the 7 cohort countries through the peer learning modalities. And with that, I would wish to welcome Sylvia to walk us through the presentation on integrated lab information systems and interoperability solutions. Sylvia, please welcome. Marcella, you're able to
yeah,
put up
no,
the
it's
slide
yeah, we're trying with the slides. It's Silvera, right? That needs to speak now. Osborne.
Yeah, sure, please. Sylvia,
Silvera,
please welcome to take us through the presentation on LIS.
Thank you.
And to
Hope
colleagues,
you are able to hear me.
And to the attendees, we kindly welcome you to put up any questions or comments that you may have on the chat box. Thank you and welcome. Please, Sylvia, go ahead.
Thank you. Are you able to hear me?
Yes, we can hear you.
Yes, thank you very much. Good morning, good afternoon to all. I'm happy to be on this panel, and I will be also happy.
Osborne, is it breaking up for you? Because it's breaking up for me. I can't hear him.
Yeah, Sylvia, we can't hear you well.
No.
Your audio is coming on and off.
Yeah. It was fine when we tested it this morning.
And as we are coordinating, and we have to thank Global Fund for this. Oh, okay.
It's going on and off, Silvery. I don't know if you can go back to where you were when we tested it earlier, because it was okay. Can we try again? Sorry, it just keeps breaking up.
Oh, how is it now?
It's breaking a little bit, but maybe try.
Hello.
Yeah, no, I think that's better. I don't know if it's your connection, maybe. Let's
better
try.
now?
It cracks a little bit, but let's try. Now you're on mute, I think. Let me see if I can unmute you.
I was
Okay.
trying to change
Yeah, yes.
the environment. Is here at
Yes,
least better?
much better, much better. Thank you.
Thank you. Thank you. Thank you very much. I was thanking Global Fund for this initiative. I think the peer learning is something that anyone would wish to have. As you understand, we come from different corners of the world, and at a given time, of course, we are having some initiatives, learned stories, we have some lesson learned, and it's better that we share all of that. So it's really appreciated to have this opportunity. So we are planning to have a 10 days peer-to-peer exchange, and these 10 days are going to be the 10 of the days of running, where we will be running across different institutions. Of course, the points that we will be talking about, they will be mostly focused on interoperability and laboratory information system. So we will start with the day one. We plan to have welcome remarks from the Minister of Health, and then we will also have the introduction of the learners, the mentees, and we will need also to hear from them what are their expectations. So, and on the same day, we are planning to visit the Kigali Memorial, Genocide Memorial Press, and we will be having to understand the history of Rwanda and where are we and what are our highlights, resilience and reconciliations. Go to the next. I don't know if the slides are moving on your side. So for me, it's still day one. Are you able to hear me?
Yeah, you just
Yes,
broke
great.
a little bit, so
Great.
we'll try. Yeah, we'll try again.
Okay, now it's good. We on day two, we plan to give the mentees the overview of Rwanda health system, because we understand you can see where the lab is, the system, how it works, but it's better to understand how is the Rwanda health system structured, because we totally understand that this will give you the overview of where do we start, what are the institutions involved, what are the levels of care that we have in country. And on the same day, the Ministry of ICT will give you now the digital transformation agenda for the government. And this digital transformation agenda includes all sectors. So this will give you also the idea on how is the ICT, how is the technology used in the whole government institutions, and it will give you the idea of what will we be seeing in the next days. Next. Yes, on day three, it will be specifically now on healthcare digital transformation. We will be talking about now specifically the technologies used in the healthcare. And here we'll be talking about how is the leadership governance, I mean, digital health. So talk about the interoperability solutions. Rwanda Health Information Exchange, how does it work? How is it constituted? What are the interoperability standards that are used in exchanging data between systems in the healthcare? We will be talking about different systems. How are they exchanging the data through the interoperability layer, electronic medical record, lab information systems? This concentration on this day, it will be much on the interoperability, how systems talk to each other, what is the basis, how does it work? And we will also be showing this specifically on different systems, how does it collaborate, and how do we monitor the interoperability of these systems. Next. Yes, day 4 and day 5, it will be much concentrated on laboratory information systems. So we will be demonstrating, but this time it will not be presentations, but it will be like live. We'll go to the sites. In the sites, we'll be seeing different things, but mostly we will go to the lab. We will need to see how our laboratory national, and also in terms of like connecting to, does it work? How does an electronic medical record from one facility order something, and then it is done at the national reference lab, and then the results comes into the same facility without moving. So of course we will be seeing this in terms of like seeing it live at the National Reference Laboratory. You can go to the next. The day 5, of course, in the National Reference Laboratory and in different facilities, we are having different tools. I mean, laboratory information systems. So we will need to study like each per each and see how does it work? What are the benefits? Why did we choose to use it? You can see we'll be talking about labware information system. We'll be talking about Virolod information system. We'll be talking about the bioinformatics molecular genetics system. And on day 6, we'll also be having some other systems that we will be visiting and see how they work. Can you go to the next? On day 6, we'll be talking about data to care, EPT, and all of these other systems. So all of these systems, we will be seeing them, how they work. What are the lessons learned? What was the implementation? How did we manage to get it? What is the advantage of having it? What is the limitations? And also, we'll be also talking about the interoperability of these systems. If I start from one system, how do I end up with another system? What are the roles of one and the responsibility of another? So you can go to the day 7. Yeah, on day 7, we are using also emerging technologies. So we plan to show the learners or the mentee, how do we now use the supply chain and how is this connected to the healthcare service. So we need to show you how the drones are used for carrying the blood, and this blood is also treated from the laboratory. You can understand that the supply chain moving from one side to another, why do you need to save life? So it needs some technologies. So we'll show you how Zipline, it's a company, and how they use drones for supporting the movement of pharmaceutical and includes laboratory reagents, moving them from one side of a country to another side. Yeah, you can go to the next. For the day 8, at least we think with all of this you will be have seen. So you will need to like think of what is the lesson learned on your side. What do you think can it be an action plan? What do you think that it can be like your starting point to change maybe what you have been using, or maybe to enhance what you have been using, or maybe to start because they may be like some new initiative that you have learned and you think it is something that you can start implementing in your country. So we will give you time to prepare all the action plan. What do you think will be the initiative, the activity? What do you think will be the evaluation metrics for you to know that you have achieved this or not? And then this action plan on the next day. The next day, we will sit with the plans that they made, and then we will need to like agree on these plans. Maybe we can give some observations on the plans, maybe to make them something feasible, and then we will also agree on how will we be like mentoring our side. So how will we be together accompanying you to put in place this what you requested in the action plan. On day 10, so we are planning to have a closing summary, and this summary will be like a summary of the whole workshop, what happened, and this report will we need to provide it to anyone from this study, so that they can be able to refer back and say, okay, we have seen this, and this one will be helping me in the in implement. So in the visits that we'll do, in the learning session that we'll be doing, so we'll be having someone to note all the lesson learned and action items that it can help you going back to your countries. How are you going to be able to put in action all of this what you are saying? Is it Chigadi? We know it will be like an intense running. So, but we will need also to have an experience. So I will give you like a half day after enjoy Chigan. That's the plan. And of course, they can be, when you are on board, there can be some additions. After seeing your expectations, they can be some other added and extended inside. Otherwise, this is what we plan for the 10 days for one group. And it will be the same for also another group. We plan to have 2 groups. And the one group spent 10 days and another group spent 10 days. So our preference would be like, because we are in the campaign this time, so we think the campaign will be ending in the mid-July. So we think maybe from the mid-July, we can have we can have the 10 days for the first group, and then in the next will be we can plan in the maybe in September or in October. We can also plan for the next 10 days. Actually, in summary, we are flexible after 15th July. We are flexible to take any of the 10 days for first group and other 10 days for the next group. So that's what we have in summary. Of course, many things will be in the presentation and the learnings. So we did not want to teach whatever we'll be teaching in the 10 days here. It was just a summary to give you the overview of what will be you can expect in this coming 10 days. Thank you. Over to you.
Thank you so much, Sylvia, for that very wonderful presentation. Walk us through the planned peer model on LIS to be supported by Rwanda. And the next stage would be to welcome you for any questions or comments that the attendees and participants may have. As Marcella puts up the Q&A, I would want to welcome our EXA colleagues, Dr. Andrew, for some quick comments before we go into the questions and comments. Dr. Andrew, please.
Thank you very much, also. And hello to everyone. I think for me, very quickly, first of all, to thank all of you for finding time to be part of this information. Important for all of us to be on the same page. As Osborne indicated, EXA will have the role of coordinating and facilitating the peer-to-peer learning experience. An international intergovernmental organization composed of countries from the East, Central, and Southern Africa. Southern Africa, there are actually 9 member states. I know we have worked with, for some of you, it may be new to you. As Osborne indicated, we have been implementing health programs for quite a long time. In fact, last week we commemorated our 50th anniversary. Our experience with around 2015, we've been a principal recipient of a number of
Sorry,
grants.
Andrew, your audio is coming on and off.
Okay. I was just indicating that as EXA, we have been a principal recipient of the Global Fund since 2015. And we've been implementing a number of projects, one of the main ones being the Regional Lab Strengthening Project, which looks at the National TB Reference Labs. And I'm quite certain that we have worked with some of you on this particular project. So we are delighted that we will be working with you in terms of coordinating the peer-to-peer learning. So we are available, we are at your service. Please feel free to reach out. Soon we'll be reaching out with more information on how we plan to conduct the first session. And of course, this will require that we are also in close contact and collaboration with our host, Rwanda. We trust that with an effective flow of communication, things should be able to move very smoothly. I think that's all I can say for now, Osborne. Thank you very much.
Thank you so much, Andrew, for that overview of EXA. And with that, we move over to the Q&A.
Alors, nous avons deux questions. La première de Romuald du Bénin. Bonjour, est-ce que les acteurs de laboratoires pays sont invités à cette séance? Et la deuxième question de Maï qui demande, est-ce que l'objectif de se servir des bonnes pratiques au niveau du Rwanda est de les mettre en pratique en fonction de nos réalités et contraintes, si j'ai bien compris?
Yes, if I may answer on some questions. Is that okay, Osborne?
Yeah,
Yes, please go ahead.
Please go ahead.
Yeah, let me start from the second question. Yes, what we are trying to do is, of course, trying to teach each other. It's to learn from each other. We know that as a country, there is some progress we have made in terms of laboratory information systems, interoperability between systems. But we know that you may be having some experiences. So what we'll be doing here, of course, we will be showing you what you have done, what you have been doing, and what's our plans. And then you will be also maybe telling us your experience in what you have been doing. And with this exchange, and based on what you have seen in our country, so we will have to, like, all of us agree on what can we do for the best of our countries. So that's like learning it to each other. It's trying to like share the experience, share the lesson learned. That will be most on what we'll be doing in this peer-to-peer learning. And another very important activity that is in this peer-to-peer is like someone will be mentoring you. So means if we agree on the action plan, as Rwanda, we will be coming to your side and see how have you done the first activity? Have you managed to complete the first one? Are you on the second one? What could be the challenge? What could be the issues? Is there maybe something that we can help? Can we share some maybe best practice that we used on our side? So those are kind of like the mentorship, and for at least if you liked the activity, if you liked the practice, so we will support you, we will mentor you to get to that activity. And the first one, est-ce que les acteurs de laboratoire pays sont invités? Yes, on our side, yes, we have invited our laboratories. So our laboratories will be involved, I mean. And we have also invited some health facilities, hospitals, because we know some laboratory information systems and some laboratory exams are performed from some specialized hospitals. So you will be having a chance to visit some hospitals and some also national laboratory. It will be also visited, and this will give you the view of what are the facility, what are the capabilities at the facilities, I mean the hospitals, but what are the capabilities also in the national lab on in terms of like doing some tests, and also how are they integrated, how are they communicating. Thank you. Over.
So just to chime in on Sylvia's response, that the digital team within the Ministry of Health Rwanda is working very collaboratively with the lab directorate in terms of the general structure for the peer learning, and that will ensure there's a very strong intervention and intersections between the digital team as well as laboratory systems intervention for this to become successful. There will be an opportunity following this initial webinar for both the 7 mentee countries to engage directly with Rwanda in terms of structuring the mentorship approaches and plan in a way that is acceptable for you both so that it moves into successful implementation. Thank you. We still welcome any questions or comments. If you haven't posted any questions you may have, please feel free to raise your hand or still put it in the chat box. Aldia, do you have any other questions? I'm completely blank on the French chat box.
Alors, c'est une question concernant les ressources. So, sorry, in English. It's a question related to the resources and the materials from the session. So, confirming that we will share the recording and the presentation with the participants.
Thank you. Do we have anyone with any other questions or comments?
N'hésitez pas à lever la main si vous souhaitez prendre la parole également.
Yeah, it seems we are all good, and at this point probably can bring the webinar to an end. Thanking you all, and I would want to welcome our colleague Fatim to give any final closing remarks. Fatim, sorry for ambushing you.
Osborne, there is a hand from.
Sorry, I can't see hands from my side. Marcel, are you able to unmute the individual who has a question?
Yes, we welcome Bakari to speak, and he should accept the invitation to speak.
Bakari, please go ahead.
Bonjour, chers tous. Vous m'excusez, hein. Bon, j'ai levé la main parce que j'ai rejoint la réunion un peu tardivement là. Donc, mais je suis un peu rassuré, comme quoi les présentations et l'enregistrement seraient partagés avec les acteurs. Et je crois que s'il y a des préoccupations, il y a toujours aussi des contacts par lesquels on peut vous saisir pour pouvoir avoir plus d'éclaircissements. Je vous en remercie. Merci beaucoup.
I just wanted to say thank you again to all the mentee countries that joined, but also thank you to Rwanda, Dr. Silvera. Thank you so much for also accepting to be a mentor country for the rest of the countries that are coming. And thanks for the presentation. Also always thanking Andrew and his team. And finally, our communication team, thank you so much for all the support. We're looking forward to the travels to Rwanda. I'm not sure if dates were mentioned during the presentation, but I think if not, the dates will be shared. If the Rwanda team can advise on the dates for the different cohorts that are going, such that we can start the planning, so that Andrew and team can start the planning and visas, etc. As you heard, these will be handled by Andrew's team, EXA. They'll be handling your travels to Rwanda, your per diem, etc. So we look forward to having this kickoff very soon to allow the mentee countries to also go back and work on the action plan, as Dr. Silvera has said, that you will be implementing in your country. Again, this is about implementing Global Fund grants. We're not just going to Rwanda to see how beautiful Rwanda is, but to also go back to our countries and implement and make sure that we absorb the funds that we have in our grants. Also remember, these funds, as some of them are C19, some of them are DC7, C19 ends in December 2025. We need to make sure we implement integrated lab information systems. So you develop your work plan and there's no funding in your budget, please talk to your Global Fund country teams, see how they could reprogram, identify savings to ensure that the different lab interventions are also implemented. So we continue to work together. You have, and you know who your Global Fund country teams are, but also who your lab advisors are. For the different countries. I think most of it here is Juliet and Osborne. So let us all work together to ensure we implement such that we could have a successful DC8 replenishment and have enough funds to, again, continue all the great work that we've started in all our countries. Again, thank you so much, and over.
So thanks, Fatim. So just in closeout, there's a question in terms of official invitations. I think this is coming from Romuald, if I got the name correctly. Yes, following from this webinar, there'll be communications between the Rwanda team, Dr. Silva's team, as well as EXA, to each of the 7 countries in terms of tying up your work plans and scheduling of the visits, so that you can jointly discuss and agree on the schedule based on your timeline, given there are always competing priorities at country level. And that allows for flexibility for you to maximize on the time when you are best available. So yes, that communication would be forthcoming, and we do request that you be on standby and be responsive to the email communications. We hope also to reach out to those participating countries which were not able to attend, so that we can all work together through the peer learning implementation period. Otherwise, thank you so much for hosting you today in today's webinar. Kindly do feel free to reach out to either Global Fund, Rwanda, or EXA in the event you have any questions or need for clarification. Thank you, bye for now, and have a wonderful day.